Welcome to Prepare Tennessee LTC, a podcast created to provide resources and information on the current topics experienced within Tennessee long-term care and skilled nursing communities. I'm your host, Rachel Turner, an Associate Program Manager here at Vanderbilt University Medical Center's Program in Disaster Research and Training. Today, I'm here with Greg Edwards, a Vulnerable Population Coordinator with the Tennessee Department of Health, to discuss the Tennessee HRTS program. You are currently listening to the conclusion and part 2 of this podcast series.
Right now, the big hot topic, of course, is COVID, but here in Nashville, we experienced a tornado earlier in this year. So say a facility gets a general HRTS message saying that there's been a tornado. Is there a directory on the site where they can look and find government contacts that they themselves and their facility need in order to get supplies or get kind of in touch with those sources?
Good question. Not only does the HRTS system have links both to the Tennessee Department of Health and the Emergency Management website, I believe the directories that you're asking about would probably exist and be most easy to access on these sites. But there's also an umbrella organization within the state government website, which is called TMAR, and that is Tennessee Emergency Medical Awareness Response and Resources page. And this would be the primary portal or conduit that they could use to access that kind of information. So this is fully plugged into the state health department site and provides them with all the information they need to find the right contact for an emergency response.
Who is allowed to create an account? So would a normal Tennessee citizen be able to create a user profile, or how does that process work? Does it go through a channel where you have to have more of that clinical or emergency preparedness background in order to use the site? Or can any everyday citizen in the state of Tennessee use this site to utilize the dashboards and other resources?
We wanted to make sure that this system is developed so that only authorized personnel can use it. So to answer the question, no, an individual civilian wouldn't necessarily be able to come into this site and just create an account. Accounts are generally created using what I sometimes affectionately call the vampire method. So I've got to have administrative rights in the system to create other users who may in turn administer their own groups of users. So we're able to give a lot of autonomy to the facilities once they're set up, but not just any individual can, wander into the system anonymously and create an account. You're right, though, that they can often consume a lot of those dashboards. The dashboards are maintained as part of a public state data system. And so a lot of that information, the dashboard, can be searched publicly, but none of that information can actually be updated back in the system except by an authorized individual. And we keep pretty detailed records of who's making each change. We don't want this system to ever feel like it's being used as a big brother type system, but we do want our users to feel confident that the data they put in there is maintained with integrity. And so any change that's made is date time stamped along with user credentials. So if we ever need to know who's going in there and updating that information, it's very easy for us to run audit reports and find out, who's maintaining data at a specific facility. But yes, everything is completely secure and the data is encrypted. But for example, if I come into a particular facility and I click on an edit button here to make a change, I can see who last made that change and I can actually see when the data was last updated. And this data was just updated earlier in the day today. So we try to keep everything very, very current.
Is there a way for a facility to track what they have put in over time so that, say, for example, surgical masks, they can see maybe the rate in which they are using or not using their surgical masks? Does the website keep track of all of it or just the current, most up-to-date that you're putting in?
The page that you're looking at here tends to be more of a current snapshot. So it's a tool that we ask the facilities to use for reporting purposes. But of course, all of that data is maintained historically. The system itself doesn't really provide me with a way to go back and review that, but there are a number of reports that I can run, as well as some of these dashboards. So depending on the dashboard, they oftentimes include date filters so that I can look at data across a specific date range. So you can see, for example, here we have a time frame data. So I'm looking in aggregate since March. But if I need to look at a more specific frame of time, then I can use that control to zero in on more specific data. Within Hertz, I can go to the reports menu, and certain users can run these reports. Again, that's really up to the facility to decide what level of access they want to give everybody, or maybe this is just for, their director level staff. I'm logged in with kind of a special super admin account here. So I'm actually able to see and do things at a state level. But an individual using this system, first of all, would only be able to see the facilities that they've been assigned to. And then even within the context of that, would only be able to make changes that their user permissions allow them to make. So if I was a facility administrator and I wanted to be very conservative with what I allowed my staff to do, then I might set up most of my users with a really limited set of permissions. And so in those situations, they wouldn't necessarily be able to add new bed types. They wouldn't be able to delete or edit data that's been previously entered. Perhaps all they'd be able to do would be to click the update button, and then they could make changes to current availability and occupancy. So the system is very much geared around individual permissions, and what you're seeing here is not necessarily what everybody in the system would see, even if they could access this page. The tools and menus that they see are very much based on user permission.
So a facility, when they register an account and they have the main admin, who's probably the manager or the director of the facility, they can go in and create one of their staff to give them that admin ability so that they can say, this is your job to log this once a week, and only they can edit the physical numbers, correct?
That's correct. And this is something that I would typically cover in greater detail in the administrator training, but I'll take you into my user account page so that you can see what we're talking about. This is the kind of information that the system tracks on an individual user. And so we've got, basic contact information, but what you're really talking about is this area right in the middle of the page. And so you'll see that I'm set up as a regional user covering the East Tennessee region. But if I were just a facility user, then I could have roles that were more specific to the facility. So an administrator might come in and say, I want this person to only have facility user view only and update roles. What that allows the facility user to do would be to look at their facility page and update just those numbers that you saw in those boxes. So they wouldn't be able to add new service lines. They wouldn't be able to edit existing resource types or total capacities or any of those numbers that would be more along the lines of the facility's setup. They would just be able to come in and kind of use the system to update counts on a weekly basis. Now, if I was a more powerful user, I might need to have the ability to come in here and create other users at that facility. And so if I was a facility administrator, I'd probably at least have these roles, which would allow me to do pretty much anything I need to do. But again, I'd be limited to only working with my assigned facility. And then there's a whole system down here where we are able to match specific healthcare providers and office staff with the facilities they support. And this allows for just an incredible amount of flexibility. We have a lot of these facilities, of course, that are corporately owned or maybe part of a larger medical group. And so if we have maybe a network that is administered by one or a team of people at like a home office, well, then we have a system in place here where those support people who might be centralized can be assigned to multiple facilities. And in that situation, they get kind of a small menu up front of the facilities that they can manage. So the system has a lot of flexibility with respect to how we organize who has access to what.
So with a facility, say one of their members, their users, no longer works at that facility, there's an option to remove them from the list or delete the account, say that individual doesn't even work in this kind of environment anymore. Is there a way to either the user delete their account, or is it just kind of stored but not active?
Yes, absolutely. absolutely. We generally leave that decision to the facility administrator, although I would imagine that any individual user could request their account to be deactivated. But a facility administrator, just like I'm doing here, could very easily come in and mark a user as inactive, and that would prevent the user from being able to log in or to use information at their facility. Now, I can get a little bit more granular there, and I could also go into a specific facility where a user has been set up, and I could remove the relationship with that facility. So this is really handy, for example, like I was talking about earlier, when a healthcare provider moves from one hospital to another hospital, we don't want to create a whole new account for that person in HRTS. We end up with a lot of duplication and confusion that way. So what we can do is we can take that person out of facility A administratively, and we can put them over here in facility B. And then there's that unbroken continuity of user experience because the healthcare provider is able to keep the same HRTS login, the same email address, the same password that they've always used. It's just that when they log in, they'll see their new facility instead of their old one. And we maintain the data integrity of, well, this person did work there at that one point in time and updated that information historically, but now they're working over here, and so they're able to continue updating their new information moving forward.
So if the user is inactive, they'll no longer receive those text message alerts.
That's right. And we actually allow individual users to control the amount of alerts they get from the system. So the page you were looking at a moment ago was me as an administrator setting permissions for a user or setting contact preferences for a user. But each individual HRTS user, regardless of whether they're just somebody working at a facility or they're managing a facility or a network facility, they can view their own information. So if I come in here and click on my user profile, which is near the top of any page, then you can see I've got a slightly modified version of that view, but I can change my own password over here. I can set up security questions, and those help me unlock my account if I happen to forget my password or my username. And then I can also set preferences such as my telephone numbers or mobile providers, and that's important for the SMS notification. But I can also set my email addresses, and I can set which alerts I want to receive. So there are a number of alerts that are built into the system. I think some of these are turned on by default and some aren't. But if I wanted to get, for example, a weekly reminder around 10 a.m. on a certain day of the week that tells me, hey, your numbers haven't been updated in the last week for your facility, then I can opt into that type of alert. But perhaps I'm not as interested, like I said before, in the patient bed matching stuff right now. So I can turn off all of those alerts, and I wouldn't get those anymore. Notice that I've turned on my facility status alert, and so that way, if a facility administrator needs to raise that alarm we talked about earlier for his or her staff at that location, I'll be sure to get that. If I don't have a mobile number set up, I'll at least get an email alert, but if I do have a mobile number set up, then I'll get an SMS alert with instructions to check in with the facility. The one type of alert that you're not able to opt out of is this event alert. And so those would be your larger, more structured events where somebody either at the state or at the region is really trying to get everyone's attention. And so those alerts do have to remain on. If somebody is really insistent that they don't want to receive those alerts, then we can control that on the back end through permissions. We can say this person is not an alerts user, and so they don't get alerts anymore. Now, for those individuals who are affiliated with one or more facilities, but they may not actually need to go in and use the system, we don't want to create throwaway accounts for those people. We don't want to have usernames and passwords and permissions because that creates a security risk. So if somebody just needs to participate in the alerts part of the system, then we can go in and create what's called a contact for that person instead. So this might be like a CEO of a medical group who wants to remain in the loop on news and things of that nature, but doesn't actually need to be able to log into HRTS and see this kind of detail. For that individual, we would just go in and create a new HRTS contact. So when somebody is set up as a contact, we track a lot of the same information, their name, their email, and their mobile numbers. But as you can see here, there's no information about what facilities they have permissions to access because there's no user account behind this. It's just a name and a phone number in case we need to send them an alert.
And is this something that each facility can do, or it's something that comes from the state that has to do that?
This is the type of thing that an individual facility administrator could do. When he or she sets up their site, they're able to decide what user accounts they want to create as well well as what contact accounts they want to create. I guess the one other thing that I would let folks know if we're, looking at this, one thing we always talk about at the end of our training sessions is this big red button. And of course, you want to use this anytime you're finished with the system for the day, or even if you're just going to be away from it for a period of time. We recognize that a lot of these systems are shared between users in a healthcare setting. And so just to maintain the integrity of the data, keep everything really private, you never want to leave your login unattended. So by clicking that big red button in the corner, that logs you out. I'd probably also recommend not tracking your user ID and password. This is my personal computer, so I do tend to do that. But blanking all of that information out after each use keeps the system totally secure. Thank you guys very much. It's been a real pleasure working with you today.
Thank you, Greg, and thank you to our listeners for joining us today. This concludes the overview of the Tennessee HRTS program. If you have questions regarding anything that was mentioned in today's podcast or would like to learn more, please visit our website at www.emergencyltc.org.